Hello viewers, Assalamu alaikum. I am Dr. Asif Mohammad Rafi and I welcome you all today to our video tutorial of MRCP PACES preparation. We are today going to talk about the MRCP PACES preparation and the changes that have been made in the MRCP PACES carousel. The changes are are going to be implemented in 2021 as the Royal College says, but it's not sure which diet it will get implemented. At first we want to talk about the PACES carousel now. In the PACES carousel there are 5 stations, as we all know, that in the station 1, 2, 3, 4 and 5. In station 1 there are 2 short cases, those 2 small cases of respiratory and abdominal system, and these 2 are 10 minutes sessions, and this is station 1. There is one respiratory short case and one abdominal short case, and there is 5 minutes interval, and there comes the station 2, which is history taking. It's 20 minutes of history taking altogether, and there will be like 15 minutes of history taking and 5 minutes of talking with the examiners, and then will be 5 minutes interval, and then it comes the station 3, which comprises of the cardiovascular system and the neurological system, and both are 10 minutes. So all the short cases, there is 6 minutes of examination and 4 minutes of talking with the examiners, and then after 5 minutes interval there comes the station 4, which involves the communication skills and ethics, and it is for 20 minutes. For 20 minutes you have to take history and to communicate with the patient or the dummy for 14 minutes, and then 1 minute gap, and 5 minutes talking with the examiners. And then after 5 minutes there comes the brief clinical consultation, which is the station 5. And in brief clinical consultation there are 2 scenarios you have to deal with, both 10 minutes, and in this scenarios there is 8 minutes of examination and history taking, and 2 minutes of talking with the examiners. So this is now the PACES carousel, and it is soon going to be changed, and the RCP says actually it was going to be implemented in the 3rd diet of 2020, but due to the COVID situation it has been changed to 2021, but it is not specific whether it will be changed from the diet 1 or diet 2. So we have to prepare us accordingly. Now, what are the changes have been made for this PACES examination? There were 3 changes that have been done. Actually, the short cases like abdomen, respiratory, cardiovascular and neurology, there is no change, so these remain same. So where is the change? The change is in station 2. That history taking was a 20 minutes session with a patient or a surrogate for 20 minutes. So it was a lengthy process, and it was not practical to take the history in 20 minutes. So the RCP thought that it should be changed. And the station 4 is the communication station. There was one communication station of 20 minutes, so they broke down this communication station into 2 stations, like 2 communication stations, 2 scenarios. And in 2 scenarios, the positive thing is in one communication station it was too big, like 20 minutes you have to talk with the patient or surrogate, so it was a difficult matter. So it has been broken down into 2 stations of 10 minutes, so it would be easier if you touch the points and talk with the surrogate. It would be easier, I think, from my point of view. And in station 5 it has been changed. Like previously the station 5 or brief clinical consultation was 10 minutes, 2 stations. Now there will be, combined with the history, there will be like consultation station. It is the new term, the consultation station. There will be 2 consultation stations of 20 minutes. So in this consultation stations you need to take the history, do the examinations and talk to the examiners. So this become like a long case of our Asian region, as we are experienced with the long case examinations. It is more like a long case examination. So there will be 2 consultation examination of 20 minutes each, and that will comprise of the history, the examination, and talking with the patient and talking with the examiner. So These are the main changes. So the carousel becomes like this. The station 1, there will be one communication station of 10 minutes and one respiratory station of 10 minutes. Then 5 minutes interval. The station 2 is the consultation station 1. Consultation number 1, 20 minutes. So there will be a combination of history and brief clinical consultation. And after 5 minutes interval, there will be station 3. There will be cardiovascular system examination and neurology examination. Like the previous exam, the station 3 remains the same. And station 4, there is communication station of 10 minutes and abdominal examination of 10 minutes. So the communication station is broken down in station 1 and station 4. And then comes the other consultation station, station 5, consultation station for 20 minutes. So I think that this is the new format. This is going to be the new format of the PACES exam, and I think it's going to be student friendly. So the preparation, for preparation, I want to advise some things. Like for systemic preparation, I mean that exams like neurology, cardiology, respiratory and abdomen, as I have practiced more or less in Bangladesh, so I will just mention in red letters that where you should practice. So the neurology, the NINS, National Institute, is the best place, then the BSMMU and the DMCH. And for cardiology, the NICVD is the best, Cardiac Institute and the BSMMU. The respiratory, NIDCH, of course, SHSMC is good one, and DMCH. For abdomen, the DMC, SSMC and BSMMU are the most important areas. But for the renal system, BSMMU is a must, because the renal transplant patients are only available in renal BSMMU. So these are like the short case exams of our country. But the difference is, in our short case exam, you just have to examine the system only. Here we have to add the general general examinations. Like if we see a abdomen, we have to do the general examinations, like we have to see whether there is anemia or jaundice or there is any lymphadenopathy. So these are the associated general examinations we need to do in the abdomen system. So this is more or less like the short case exams. So these are the systemic preparations for neurology, cardiology, respiratory and abdomen. Other than this, next we come towards the communication station. In communication station, we have to be professional when we practice with our study partners. Like the best thing is to practice the previous one year communication stations with a stopwatch. Like we have to look at the time, and we have to practice with our study partners the previous one year's communication stations. So we have to make a format, and with the format we have to practice every day, or every week we have to practice for 2 to 3 times. And we have to memorize the common rules. The common rules are like for the HIV patients, the TNAR, the angry patient, how to deal with the angry patient, the organ donation, the legal and ethical aspects of the scenario. We have to memorize these common rules. So I think that the new system, it is shortened to 10 minutes format, so it will be easier than the previous one, because in the previous one there was a lengthy process. So there was a chance that we don't have to talk about anything with the patient or the surrogate. So it was a difficult situation. So in the 10 minutes you make a format and practice accordingly, so it would be easy to cover the 2 communication stations. And now let's talk about the history. And so the history examination, I have updated a video in my YouTube channel, Asif Mahmood Rafi, that how should you approach to the history station, and how should you plan the differential diagnosis and the basic management. So just make your own format and practice the previous 1 year scenarios. That would be fine. That would be it. So in 2021, from 2021, there will be no separate history stations, but you have to take the history in the consultation station. So just prepare accordingly. That the consultation stations, you have to take a detailed history. It's not like previous one, brief clinical consultation. It will be a consultation station of 20 minutes. So you have to take a more detailed history than the previous one. So in the brief clinical consultation was previously, generally one case is from the acute and emergency department, we have to practice the dummy cases, and that is the key to success. You have to get the common scenarios for the last 1 year, and you have to practice the dummy cases, and that is very important. Sometimes some other cases may be relevant, like endocrinology, rheumatology, or gastroenterology cases sometimes come. So I have put a difference between the old format and new format, and I thought that the brief clinical consultation we practiced in 10 minutes, it is very pressured, so it is a very less time to do all the findings, all the things. So it was very difficult for me, at least. I don't know about others, but it was very difficult for me, and I am very happy to learn that the decision has been made to change this format into the newer one of consultation, which will be 20 minutes. So it will be better, I guess. And the old format, the old format was like different thing, and the new format will be like, as I have studied in Bangladesh, the long case exams in Bangladesh are same like this, so it would be easier for the local examinees, I guess. So that's all about the old and new PACES system. So I hope that you like the video, and just practice accordingly, and practice with a stable study partner, like 3 to 4. Make a group and practice and practice. That is the key to success of the PACES examination. So I hope you like the video. Just if you like the video, just subscribe our channel in the YouTube, Asif Mahmood Rafi. So thank you very much.